Darkest hour, I wanna comfort you. I know you've been alone. Oh, where do you go? In your head, when in the real world is snow. Oh, I know how you hate the cold. Spend your life searching for more. Afraid to leave, afraid to show. Fight to leave, fight to leave, fight to sometimes find yourself knowing I'm lost and looking for a soul. Grabbing for what you can hold. Sometimes realize there's nowhere to go. Cause the thing we're searching for is just waiting back home. And you've done your walking, probably enough for two. Oh, often you've had it rough, but you also had your cup filled up. And we both know every time you come around, every time you return, I see it in your tired eyes that you still have more to go.
It can't be anything like love, can it?
No, it mustn't be. It can't.
Would it be inconvenient?
Terribly. Anyway, I know it isn't. Oh, right out of my mind.
Right in.
Music.
Tracy, you're so...
Even my instincts are melting away. What is it, about our feet of clay or something? It's not part of the pool, it's just over the lawn and in the ledge grove. It'll be lovely.
Tracy, you're...
Put me in your pocket.
Sometimes find yourself knowing no, lost and looking for your soul. Grabbing for what you can hold. Sometimes realize there's nowhere to go. you're searching for, has been waiting back home. I stay waiting for you. I stay waiting for you. I stay waiting for
Jazz Club. Really flying the music. Okay. And it's so packed in here. The band sounds great. Double penniless effects. How are you? Oh yeah. Thank you. Yeah, man. Did you you went to the screening of Pull My Daisy? Yeah, did you enjoy it? Yeah. Yeah, I love that movie is great. That's the second time I saw it. David Amram talking about it. Really. I love that movie.
But you were inside. You know that. I thought it was probably the and they were taking people away. And then
Okay. All right, yeah.
Hello, everyone. Hello. Hello, everybody. Welcome. I'm going to ask everyone if they can please grab their seats. We're going to keep rolling through things while people are eating, just so we kind of stick to the timeline. We have a very packed agenda. Plus, I like to go to bed by about 8:30 at night. So, again, I just want to say hello and welcome to everybody. We are very much looking forward to tonight. As Larry let you know, my name is Miles Prue. I work for Family and Children's Services, and I support our community engagement initiatives, which has led to my role as chair of the Community Action Network for Children and Youth in St. Thomas and Elgin. And now that is a mouthful, so we generally just refer to it as CAN. For those of you that don't know, CAN has been around for a couple of decades. It's a group of service providers that are committed to finding solutions for issues that impact children and youth in St. Thomas and Elgin. Together, with the generous sponsorship of the Elgin Community Foundation, we have brought everyone here tonight. And we are excited and we are grateful about the group of individuals that is gathered in this room. This group's leaders span differing sectors across Elgin and St. Thomas. However, outside of that, we are all human beings. We all face challenges, pain, and strife. I am sure most in this room know someone that has experienced substance abuse and mental health challenges and seen the damage it can cause. Further, the ripple effect it can have on the children, families, friends, and greater community. I say this to help center us because the issues we're going to talk about tonight are not out there somewhere. They are here, they are in our homes, they are in our families, they are in our community, and they are in our lives. So over the last couple of years, CAN has identified significant worry about the mental health and well-being of our children and youth. The committee includes frontline service providers who see the abundant challenges that our youth face daily. And I've just had a couple meetings this week with different committees, which again reiterate the challenges and the extreme challenges that our children and youth are facing. Issues include increased loneliness, anxiety, substance use, and the complexity of mental health challenges. These issues are exacerbated by culture and environment that can sometimes actually increase them, as well as limitations in community resources and the siloed approach by agencies and sectors. So as a result, CAN began to ask, what can we do? What do our youth need? How do we create health? How do we create a better future for our children and youth? As we asked these questions and we began to look for solutions, Southwest Public Health presented the Icelandic model of substance prevention for consideration. And after hearing the dynamics of this model and the outcomes achieved, CAN was excited about this potential opportunity. There was a collective energy that this could mean, what this could mean and the effect that it could have. We were drawn to a number of tenets of the model, in addition to the impact that it had on the well-being of youth. So we like the model's collaboration of community, bringing together various sectors and platforms that focus energies on a common goal to create the greatest opportunity for positive change. We were excited about the model's use of data to inform specific issues and challenges that are distinctive to our community in Elgin and our youth, which provide real-time insight to work from. Now, those of you that do sometimes work from data to inform decisions, you know that results can take 2, even 3 years to work from. With this model, it's real-time data that you're working from. We were excited about the model's focus on the various domains of a youth life, where they spend the most time, their peers, their family, their community, and their school. Finally, we were excited about the process of considering how we can create an environment that puts our children in the best position to be healthy, well, and connected. We know the power our environment holds over our youth's choices and opportunities. Proactive prevention really is going to be the only way we're going to be able to keep up with the culmination of issues we're seeing today. Now, the scope of implementing this model, it is laborious, and it's beyond what CAN can do alone. And that is why we have called each and every one of you here tonight. You are our political and our community leaders, our schools, our mental health organizations, our faith organizations, our parents, our youth, our concerned community members. You are our community. We wanted to gather local decisions and change makers, the action takers, to hear about the model and discuss collectively the benefits a model like this could offer. So my ask for everyone tonight is that I hope you listen with an open mind and contemplate the many angles we must consider as we think through the utility and the scope of this model. I also hope that everyone comes with an unbiased outlook and an open heart to consider what might be possible, what potential we have to collectively create positive change, and what we want for the future of our children and our community. And with that, I'm going to turn things over to Larry, and we're going to get it started.
Thank you, Miles. We will now hear from the first of 3 speakers, and as you're listening to them, you probably will have some questions. Please jot those questions down so that you don't forget them. We'll have a Q&A a little bit later. Well, if you want to know where we'd like to be, it's very good idea, I think, to have a good sense of where we are. And so our first speaker tonight is Jenny Santos, who's an epidemiologist with Southwestern Public Health with an extensive background in public health, having worked at several other health units, including Middlesex, London, and York region. Jenny has a Bachelor of Public Health from Brock, a Master of Science in Epidemiology from the University of Ottawa, and enjoys running in her time off. Jenny.
Good evening, everybody. So at Southwestern Public Health, we recently did some analysis looking at substance use in our local youth. So that being said, it's not specific to Elgin St. Thomas, but of course it's included in our health unit region. So anything I say tonight, just keep that in mind. So the data source for the data that I'm going to be presenting to you tonight is called the Ontario Student Drug Use and Health Survey, or OSDIS for short. This is a biannual survey that's conducted by CAMH. And this particular survey looks at 7 to 8 grade students as well as 9 to 12. And each of those groups have 2 different surveys that is used to collect information on substance use and other behaviors at school and belongingness and other information like that we can get a sense of why students might be presenting with certain behaviors. So first we have here that more than 50% of Southwestern Public Health youth report using alcohol in the past year. And this is about 10% higher than the proportion that was reported across Ontario. Another thing of note is that approximately 25% use cannabis, and a third report having participated in vaping in the last year. And all of 3 of these are higher in Southwestern Public Health region in comparison to Ontario. So, and a lot of these differences are at least 10%, 5 to 10%, which is a considerable difference. So it just starts to create that picture of what's going on locally and how it is different than what we would expect to see in children in this age group. This graph here shows the grade range of youth by when they report first having used alcohol, cannabis, and tobacco. Locally, most youth start using substances in grade 9, so this indicates the potential impact of an initiative like this, targeting youth maybe even around a little bit younger than the youth covered in this survey, so maybe even starting as young as grade 6, to kind of, again, have maybe an impact on reducing or extending, I should say, that initial age that they're reporting using substances. In terms of how easy it was to access substances, youth in Southwestern Public Health and Ontario reported similar ease of access. So you can see here that most youth think it was easy, quite easy actually, to access alcohol, tobacco, and cannabis. And you can see from the red bars and the green bars that locally it's pretty comparable to Ontario, with the exception of ease of access of prescription pain medications. And this is not surprising considering what we just saw in the earlier slide, that a lot of our youth in Southwestern Public Health report using more of those substances in general. So it's not a big surprise that they're saying it's much easier for them to access those substances. When asked about where they got the substances, Southwestern Public Health youth reported, again, similar sources as Ontario youth. So you can see that most youth report being given alcohol by a family member. And I just want to say, by family member, this does not necessarily mean that a parent is giving alcohol to their child. It could, but that not necessarily. They could also be getting it from another adult or even an older sibling without the parent's knowledge. So that's an interesting factor as well, which we'll get into a little bit of the meat of that in a little bit. In this slide here, we can see that more youth actually borrow or try a friend's vape or cannabis product rather than buying their own. And here, again, you can see our local rates are the darker bars. In Ontario is the lighter bars, and it's pretty comparable across the board. Next, we take a look at protective factors, which could reduce the likelihood of youth using substances. So the protective factors that we considered, and these were also included within that OSDIS survey. So this is just an example of other types of questions that they can ask that we can get more context on behaviors in these age groups. So we looked at the proportion of the youth that felt close to people at their school, that felt like they were a part of their school, that felt like they were treated fairly by the adults at their school, and lastly, the proportion that reported being able to talk to their parents about their problems or their feelings. So we looked at whether youth reported any one of these, and as well whether they reported using alcohol, cannabis, tobacco, and to see if there's a relationship. And the numbers I'll be presenting might be a little confusing, but in general, the smaller the number, the better it is. So I will explain that in just 1 second here. So in this slide here, we can see that youth who felt close to people at their school had reduced odds of using tobacco and cannabis specifically. So we highlighted that by making the bars darker. And essentially what these numbers mean is that a youth who felt like they were close to people at their school had a 0.42 reduced odds of smoking tobacco cigarettes. And the bottom is the same interpretation. So of youth, again, who felt close to people at their school had a reduced odds of using cannabis. And essentially, that just means that they said, yes, that they felt close to people at their school, and yes, they smoked tobacco or cannabis in the last year. So this just goes to show, or to give a little bit of context again on how we might be able to intervene and have an impact. And the next 3 slides will be very similar, but looking at the other 3 protective factors that I mentioned. So in this one here, we can see that youth who felt they were a part of their school also had reduced odds of various substances. And in this case, the bars, the dark ones that are highlighted, are the ones that stood out in the modeling. So again, tobacco and cannabis, both last 12 months. But for this one, it's different from the last slide that we just saw, as we're seeing that those youth who reported feeling as a part of their school also had a reduced odds of drinking alcohol in the last 12 months. Next, we have that youth who felt like they were treated fairly by adults in their school also had reduced odds of smoking tobacco in the last 12 months and alcohol. So again, in the last 3 slides, that tobacco one is standing out specifically every time, and alcohol twice, which are that were reported the most used in our youth. And the best for last was the proportion of youth who reported being able to talk to a parent about their problems. This one was across the board reduced odds of using any substance. So this really highlights the need to support those parent-child relationships, both at school and at home in the best ways that we can. And I think that's probably the best from the 4 that we looked at. And again, the data is limited. It's from 2019. And like I said, the 4 surveys that make up this survey are all different depending on the school and the age group. So it can be a little bit inconsistent and dated. So again, really highlights the need for that real-time data. So in conclusion, substance use among youth in the Southwestern Public Health Region is clearly an issue for various substances. Over half of youth, grades 7 to 12, reported drinking in the past month. Most youth start experimenting with substances in grade 9. Most youth thinks it's easy to access cannabis, tobacco, and alcohol, and that they can access these substances through their family and friends. Just a bit. Okay. Thank you.
Thank you very much, Jenny. Thank you for providing a detailed context for us to understand. And now I'd like to welcome Robin Patrick to talk about the Planet Youth model. Robin is a public health and community development professional with extensive experience in primary prevention, program development, and community mental health. She lives in Vermont, the United States, and is community development advisor at Planet Youth. Before joining the Planet Youth team, she facilitated implementation of the Planet Youth methodology in Vermont and supported communities in creating healthy built environments through strategic planning efforts, cross-sector collaboration, and statewide partnership building. In previous roles, Robin also worked in community health promotion, direct service in community mental health, and international community development. Robin holds a Master in Public Health and a Bachelor of Arts in Community Development. So welcome, Robin.
Hi, everyone. As was just mentioned, I'm Robin Katrick. I'm the advisory manager at Planet Youth. Something I always like to start with is I did implement this in Vermont. I was the coordinator. I really built this project from the ground up. So I know what it's like. I know what it's like to be sitting here thinking about, can we do this? Will it work for our community? And I really encourage you to come up, ask me questions, talk to me about this. I'm happy to be honest and give you any answers that would be helpful in your journey on this Planet Youth Guidance Program. So I want to talk a little bit today about what this looks like. If I can get the slides to move forward, maybe we'll talk about that. Oh, there we go. Thank you. So to start, what is the Planet Youth Guidance Program? So this guidance program is a population-wide primary prevention process, and it's designed to have a long-term impact in communities by reducing substance use. It's based on the Icelandic prevention model, so you may hear me use that term throughout. The Planet Youth Guidance Program is based on that. And instead of discussing the facts and the faults of substance use, Planet Youth treats society as the patient. And this is a community-based approach. So I always talk about this. If you're in a meeting with me, if you're in a training with me, I always talk about how important it is to really let the community lead the way with this. We're really looking at pulling together community sectors to have a collaborative effort in implementing this Planet Youth model. And as I just mentioned, the community knows their resources, they know the capacity, they know the avenues that are needed to reach intended outcomes. It's so important to listen to the community and let them lead the way with this effort. There is usually a local coalition, there's usually a local lead. However, it's so important to be collecting that feedback from the community and really involve them in this effort. And we're talking here about upstream thinking. And that really means that we're implementing upstream activities to prevent problems before they occur. And that means that that's going to have happier, healthier children in your community, which leads to happier, healthier adults. So we're really looking far upstream to catch the problems before they even start. And our focus at Planet Youth is primary prevention. It's also sometimes called universal prevention. So primary prevention prevents the development of substance use before it starts, and we're joining forces with researchers, policymakers, parents, and caregivers, people working with and for children in the community. And you may have seen this slide up earlier. We're talking about risk and protective factors here. This is key. So a risk factor are factors in a young person's life that increase the likelihood of substance use, whereas the protective factor decreases that likelihood of substance use. And in the Icelandic prevention model, we really focus on 4 domains with the risk and protective factors. These 4 domains are where young people are spending the most time in their community. And this isn't to say that you can't focus on any other domain. It's just where young people are spending the most time is with their family in the leisure time, which is sometimes called the out of school time, school, and their peer group. And risk and protective factors in these domains can look like time spent with parents, caring and warmth, the support they receive, and the monitoring they receive. In the peer group, there can be both positive and negative impacts, how we as parents and the community approach the peer group. Staying outside late is another peer group risk and protective factor. In schools, bullying, safety, and attitudes towards studies are examples. And in the leisure time, it's quality organized activities versus unorganized activities with no supervision. And the core elements of the Icelandic prevention model are that it's evidence-based, it's a community approach, as I just mentioned, and there's a dialogue. We create and maintain a dialogue between research, policy, and practice. Uh-oh, might be having issues again getting it to go forward. But this is an important slide to land on, so we can stay here for a little bit. Perfect, thank you. And Planet Youth is based on 5 guiding principles. So applying a primary prevention approach is guiding principle 1. And guiding principle 2 is emphasizing community action and embracing public schools as a natural hub. And I always like to add a statement to this where public schools are a natural hub. This is where people gather in the community. This is where youth are. This is where parents are. But this isn't all falling to the schools. This isn't a school project. This is a community effort to develop a primary prevention approach. And schools should absolutely be involved, but this is the community's responsibility. The guiding principle number 3 is engage and empower community members to make practical decisions using high quality data. And I'll talk a little bit about that high quality data in a few slides. The guiding principle number 4 is integrating researchers, policymakers, practitioners, and community members and make a unified team to really solve these real world problems in the community. This is all about being a collaborative approach. You can't do this on your own. You can't do this individually in organizations. You really need to bring the whole community together and support building a healthier environment for young people. And then probably one of the most important things is you have to match the scope of the solution to the scope of the problem. So these things didn't happen overnight. Youth substance misuse doesn't happen overnight. And we have to make sure that we understand that the solution isn't going to happen overnight either. It takes a lot of patience, it takes a lot of effort and work, and we really need to emphasize that long-term intervention. And this has worked in Iceland. I'm sure many of you have seen this slide before. I feel like it's all around the world now. I do like to show it though because it has been very effective. Iceland went from the highest to the lowest in substance use. 15 and 16-year-old students are surveyed, and as you can see here, from 1998 to 2022, they had a significant drop. And I want to talk about this a little bit. The then facts on the left are from 1998, and then the now percentages are from 2022. As you can see, students reporting they were drunk in the last 30 days went from 42% to 5%. And smoking daily went from 23% to 1%. And then lifetime substance cannabis use was 17% to 7%. Time spent with parents increased significantly. They went from 37% to 74%. And sports participation, which is 4 times a week or more, went from 25% to 41%. So these numbers are pretty significant, and it took a long time. They didn't do this overnight. As you saw on that chart, it was from 1998 to 2022. But they did get there, and they are improving their numbers significantly. And I want to go back to schools being a natural hub. Again, it's not a school initiative, it is a community initiative, but schools are where we reach students, and it's often where we reach parents. So the schools are really involved with the biennial survey. We have to survey the youth to get that high quality data. So the schools are where we're going to be surveying those young people. We are commonly surveying 15 to 16-year-olds across most sites. That's the age group that they choose. Some sites do expand that slightly. It will be up to your community what works best for you. The survey has 60 to 70 questions, and there is some flexibility there. If you want to ask questions specific to your community, we can be flexible with that. And then students share several factors in their lives through the survey. We aim for an 80% participation rate, so we have high quality data. That data is then processed in 6 to 8 weeks. So this is really quick turnaround data. I know in the United States, it sounds like here in Canada too, sometimes youth take a survey and you get those results 1, maybe 2 years later, and it's not really high quality real-time data at that point. By that point, those students have been long gone in the community. So this is young people telling you what's happening right now in their lives, and you can take action. Those reports are then delivered to municipalities. So within that 8 weeks, you're getting your reports back. The great thing is you get reports back for the municipality, but you also get reports back for the school. The school reports are just for the schools. They are not distributed, but it's there for the schools to have and do what they want with that and create their own actions. The municipality reports are what the coalition is going to be working with. And we're building action on data, using knowledge to build a better future for children. This is so important. And we ask about a lot of things. So you saw those domains earlier where we focus our risk and protective factors, but the survey really looks into anxiety and sleep and negative life events, studies in schools, parents and family, substance use, community safety, and more. So you're really getting a wide variety of indicators that you can work with. You get that data back. You get the raw data set after we deliver the reports. So you have this really high quality data you can work with. And why is this important? This data allows community partners to understand the situation. So you're understanding what's happening in your community right now, and you can take action with it. And then with informed actions, you can increase the protective factors and decrease the risk factors and ultimately change the environment of young people. And I like to include this graph of community partners. So coalition building, I'll talk about that in a couple slides, is one of the first steps in the Icelandic prevention model. These are often the types of community partners that you might see in your coalition, but it's not always the case. You might have a smaller group to start, and that's okay, and it will build over time. But commonly across our sites, you might have parents and caregivers, you'll have school representatives, public health professionals, community serving organizations, and more. And so let's talk about this a little bit. The 5-year guidance program at Planet Youth. I've been telling you what this is. So what does it look like if you sign on? So people sign on for 5 years, and sometimes it's continued beyond the 5 years, but I'm going to focus on those initial 5 years. You collect data every other year, so in years 1, 3, and 5. And when you're going through these data cycles, it's a 2-year cycle, you're going through the 10 steps of the Icelandic prevention model. So you're collecting data, you're disseminating that, you're creating actions and strategies, you're following up and evaluating if it's working well, and then you're collecting data again. So let's talk about those 10 steps. And I won't dive too deep into this because I know we have more speakers and I want to get to them and the panel later, but there is a lot of information out there if you want to dive further into this, and I'll make sure you have that before I leave. Step 1 is all about local coalition building. That's what I was just mentioning, how important it is. It builds the foundation for this work. Without a coalition, you can probably get through these steps. You can probably implement in the community, but it's not going to be sustainable and it's not going to be as effective as if you have a large group of community sectors working together collaboratively. And step 2 is all about funding identification. And this is going beyond just coordinating the effort. This is all about community implementation of actions. It's making sure you have the funding to have this be a long-term effort. And then step 3 is all about pre-data collection. You'll be in a training with us at Planet Youth. We talk about the survey. We talk about what it looks like to collect data and how we're going to process that data. And then you also are engaging the community. So you're getting people excited about this work. You're getting them excited about the youth survey. And this is all about building community awareness. I consider steps 1 through 3 capacity building. Sometimes communities do this even before they've signed on to our guidance program. They kind of jump in ready to collect data, which is amazing. But sometimes communities sign on and would really like their help with this capacity building. So we do that as well. Step 4 is data collection. This is where youth are taking that survey. We want an 80% participation rate, so it's really important to have that community awareness in step 3 and engage the parents and engage the youth around this so that you can have a really great participation rate in the survey. Step 5, while we're processing that data at Planet Youth, you all are engaging the community and getting them excited to see these results. This is where you're probably planning community meetings and getting people ready to receive that data. Step 6 is dissemination of findings. You get those results back. We go over them with the coalition and the leaders in the community, and then that is disseminated to the community. We help you create those dissemination plans, and we help you learn how to collect community feedback so that you can create goals and strategies, which is in step 7. By the time you're done with step 7, you have an action plan in place for your community. Step 8 is policy and practice alignment, and this step is a little tricky. In the first few years, you may be looking at creating actions based on policies already in the community, so you're trying to align what you're doing. It can take a while before laws are actually passed. I always encourage communities to not get discouraged if you haven't passed a law in the first few years of implementing this. It does take time. And then step 9 is immersing the children in these primary prevention environments. These activities that you're creating in the community, you're going to immerse the youth in these. Then step 10, you are reflecting, you're celebrating, and you are repeating. So I always say it's important to reflect and celebrate what you've done. And step 10 is just as important as all these other steps. You really have to think about what we're doing and how we want to move forward. And so I kind of went through what we do and what we are. I want to talk about our organization a little bit so you know who we are. We're a global organization. We're engaged in social innovation, and our mission is to empower communities to create healthier environments for children. And we're a private organization, and we're largely funded by charging partners for our services. So it's not profit-driven, and we do not pay dividends. Our profits are used to build a stronger organizations, and it's owned by its employees. I want to talk about what we do as specialists. We have a lot of different departments on our team. We're a small team, but we do have different departments. We have analytics and advising and project management and knowledge development and all these different departments to support you. So we offer advising services on community implementation, coalition building, intervention, and strategy development. This is largely what I do as an advisor. So if you do sign on, you might be working with me when you're creating strategies or coalition building. We have really great trainings. We have a training series. I'll talk about that in a few slides. It includes coalition building, data collection, using the results, and more. We have data analysis and reporting. We have an amazing analytics team that gets you your data back really quickly and helps you understand it and make sure you know how to use it in your community. These reports that you get back, we really put a lot of time into them to make them understandable and make it usable data. We have project managers. So if you sign on, you're assigned a project manager, and they help lead the way. They make sure you're working through those steps. They make sure you're connected to the rest of the team at Planet Youth. So you're never too far from any of us. The project managers are always making sure you have the support you need. And then we develop tools. So we have a community implementation guide. We have a process follow-up that helps you understand where you're at in the 10 steps, and more tools. And then we evaluate the process. We have evaluators on our team that can support seeing if this is working well in your community. So I want to talk a little bit about a few of those examples of tools and support we offer. I promise I won't talk at you too much longer. I know we have other great speakers here today. One of the tools we have is Community Implementation Guide. So this actually, I'm very partial to this tool that we offer communities because this was my first project when I joined the global Planet Youth team. And it's a 92-page guidebook, and it runs you through the 10 steps. It tells you what you need to know and what you need to do in your community, explains it really well. It tells you how to talk about Planet Youth. It gives you some ideas of what others are doing in the communities as well. And this is our training series. So this is our typical training series that every community gets. We have an intro to Planet Youth, we have coalition building, we have a preparation for data collection, results review, dissemination planning, and goal setting and action planning. The first 3 happen before your survey is implemented, and the last 3 happen after you get your results. However, we offer way more workshops than this. When communities are needing something specific, we offer workshops such as parental engagement. We talk about the parent contract and parent cafes, which are very popular initiatives in communities. We talk about the Prevention Day that's very popular in Iceland. So we do have specialty topics that we provide workshops on as well. And this is a process follow-up tool. This is a really useful tool, and I wanted to mention it here. Every 6 months, we have our communities take a survey, and it's usually the community lead, and they talk about where they're at in the 10 steps. We ask a lot of questions that follow along those 10 steps I just explained, and it helps provide us an idea of where you're at in the timeline, and also if you're implementing the steps appropriately or if you may need more support. So this is an example of a report you might receive after filling that out, and where there may be some red flags that need some work, and that's probably where the project manager or I would come in and have a meeting and help you figure out what we need to do to move forward. The green flags are you're good to go for another 6 months. So this tool lets you reflect on efforts before you get to the end of the data cycle, that 10-step cycle. Which allows you to adjust action plans more quickly and get back on track if things aren't going well. And I'm on my last few slides here, but I do want to say you're not alone in this. There are Planet Youth partners around the world. I know we talk a lot about the success in Iceland. However, this model is very adaptable. As you can see here, all those yellow countries that are highlighted are countries that have Planet Youth communities. They're implementing this. It is very possible. You're not alone. You are connected to these sites when you sign on. And this is all of our responsibility. I have worked in public health for a long time and community development a long time, and I know sometimes we can point fingers and say, oh, this is not my role, or this is not my job, or this is someone else's in the community that has to deal with this. But this isn't what Planet Youth is about. It's everyone's responsibility to create a healthier environment for young people. So we're doing this collaboratively, we're pulling people together, and we're saying, let's tackle this together. And finally, Planet Youth is not a project. So I often think of projects having an end date and projects being a shorter term thing. This is really about changing the way we think about prevention. We're changing the way we work together, and we're acting in a different way. And this doesn't happen overnight. It takes a lot of time. It takes a lot of patience. I truly understand how badly you want to see outcomes and results, and having to wait for many years and build off of actions can try your patience, but it does happen, and slowly but surely we get there. So change doesn't happen overnight, but it does happen. And that's it for me. So thank you so much for listening to me.
Been sitting for a little while now. So we are talking about kids, so we're going to play a little bit just for 5 minutes here. I'm going to ask everyone to participate with me. I listened to Jim Quick, who is a learning expert, and he has a saying that says, when the body moves, the brain grooves. So I'm going to start with one person over here. I'm going to ask them to do an action. Karen, I'm going to start with you because you like to get in. I saw you dancing there before. I'm going to get you to help me out. She's going to do one action, and then I'm going to separate them. So then this 4 tables are your group together. These 5 tables in the middle are grouped together, and then everyone on that end is grouped. When I point you to show you the action, I want you just to copy the action, and don't change it till I point to your area. Can everyone hear me? Do I need the mic? Okay. Well, yes. Just follow me. It's not that hard. Karen, this is all you got to do. Start like this. I just want you to rub your hands together like that. Okay, can this whole area rub your hands together? Everyone here, please rub your hands together. And then the back corner, rub your hands together. Okay, this section here, I'm going to get you to snap for me, please. Everybody snap. This section here, please snap for me. This section at the back, snap. Okay, now I need everyone over here, just do this. 2 fingers. Hit your 2 fingers. In the middle here, 2 fingers. At the back there, 2 fingers, please. Next, I need everyone to slap on your thighs. Slap on your thighs here. Slap on your thighs at the back. It's raining. Thank you, everyone. I appreciate that. We just wanted you to move for a second before we get into our next activity. The other thing I do like about that is that we started with one person. Karen started, and it was quiet. We could hear it. These tables started. And you can see, to me, this is about the power of how it sounds and comes together when we all work together as a team. So I appreciate everyone just participating in that with me. Larry, I'm going to turn it back over to you.
Learning in action. Thank you, Miles. How would you like it if the health unit that you work with was called the Porcupine Health Unit? I just think that's a very, very cool name. And of course, we all know that porcupines live in Timmins, Ontario. So now I would like to introduce to you Caden Hardy. Caden is a health promoter leading the implementation of the Icelandic prevention model in Timmins with the Porcupine Health Unit. Caden completed her undergraduate degree in health sciences at Western University and her master's degree in developmental psychology at the University of Toronto. Caden has a passion for improving the well-being of communities driven by the experience of health disparities in Northern Ontario. In her free time, Caden enjoys living the pug life. You can ask her about that. Reading and listening to Taylor Swift. Caden.
Thank you so much. So I'm Caden. I'm the Planet Youth lead in Timmins, which is about 9 hours north of here. So I'm going to be sort of walking you through our progress today implementing this model, which we've been doing for about 4 months now. So flashback to like 30 minutes ago when Jenny was talking about the local data and upstream strategies, our local health unit has also been learning about upstream strategies because of the provincial and the local substance use data that we were seeing. So being in the north, we really don't have access to much localized data for our youth. But what we do know is that our rates are typically higher than the provincial average. And so the lack of local data has been a real gap in our area, makes it really a challenge to understand the scope of the problem in our area. It also makes it a challenge to plan and implement initiatives for youth. And so one of Planet Youth's guiding principles is that the scope of the solution needs to match the scope of the problem. And right now we're really trying to understand the scope of the problem in our community. So we connected with the folks at Planet Youth back towards the end of 2022, and using our Northeast connection with the North Bay Health Unit and the Temiskaming Health Unit, we had Jan and Robin visit our cities, and we held an event very similar to this one to introduce the model and the approach to our community with a goal of gauging the interest. And it really went from can we do this to how are we going to do this because we need to do this. So truly, it was an opportunity to bring together the right partners and take an intentional approach to building partnerships. So again, introducing the IPM to the community, to local community partners during a community session with the goal of exploring the feasibility and the interest is a significant step in the process of implementing any public health strategy. But we really use this opportunity to generate interest and commitment from our community partners, which again is really crucial for the success of any public health initiative. So we kind of like today, we highlighted the positive outcomes and the successes achieved in Iceland through the model, and we encouraged open discussions and brainstorming sessions to explore how this model can align with our community's goals and priorities. At the end of our sessions, we left some time for our partners to complete a pulse check survey. So the survey was designed to gauge, again, the feasibility and the interest levels of our partnering agencies. It was also an opportunity to stay in the loop. So we had Likert scales to determine how our partners felt about the IPM being a good fit for our community, another Likert scale to kind of assess the capacity in which our partners could contribute to this work, their level of commitment, an opportunity to share any concerns that they might have with that model, and again, an optional contact session. So being a small community and having relationships with most of our community partners beforehand, we did manage to reach our audience at the time was of decision makers and community leaders. This survey ended up coming in handy once we began mobilizing our community partners and building capacity and organizing our coordinating team. So again, our very first step in this process after our community event was getting the schools on board. Schools are often deeply integrated into the fabric of our community, and partnering with them allows us to foster a sense of community ownership, foster those relationships, and collective responsibility when it comes to youth well-being. So what we did was we outlined our approach in a memorandum of understanding. We got all 4 of our school boards to sign it, along with our medical officer of health. And then we took some time to host a school-specific meeting where we were able to address any school-specific questions or concerns with our school community. It was also an opportunity to begin collaborative planning with our schools. So again, it was really, really important to emphasize, like Robin was saying, this is not a school project. This is a community project. We understand that everybody is at capacity, but also we need the schools because they're key. They offer access to youth. They provide those structured environments for engagement. They help facilitate data collection. They contribute to the overall well-being and development of young people. Their support will significantly enhance the effectiveness and the sustainability of any public health or community-based initiative, but especially this one. So the thing I've often told partners to remember is that upstream strategies, again, they build those protective factors that can mitigate risk. So in public health, these are the strategies we want to focus on, these upstream primary prevention approaches, because they're focusing on the root causes rather than the symptoms. Again, the Planet Youth approach sees society as the patient. So the question becomes, how can we prevent issues such as early substance use from occurring in the first place? Moving upstream requires that shift in the way that we think about substance use from an individual perspective, from that more community, that more collective perspective, and from short-term goal setting to really setting those longer-term goals. Primary prevention efforts often require very long-term commitment. You're going to hear that a lot in order to achieve those meaningful results. Paid protected time ensures that individuals or teams that are working on these prevention initiatives can dedicate consistent effort over an extended period without being pulled away by other responsibilities, without doing this off the side of their desk. So the Porcupine Health Unit cleared my portfolio in order to take the lead as coordinator for Planet Youth in Timmins. And when individuals are paid for their time dedicated to prevention, they can fully focus on planning, implementing, and evaluating the programs and the projects that they're implementing. And this dedication is going to lead to more effective and efficient prevention strategies. Effective primary prevention also requires strong community engagement and collaboration. Not doing this work off the side of your desk enables you to build a strong foundation that facilitates that collaboration between community partners. It fosters partnerships that are essential for the success of this model. So prevention strategies may also need to evolve in response to the changing community needs or any emerging trends. And having that dedicated time allows you to, it creates that space for creative problem solving. So partners can also expect measurable results and outcomes when there's a person coordinating and devoting their time to this work. It leads to a more transparent and effective prevention approach. So because of our health unit prioritizing this factor for success, we're prepared to implement our first cycle of surveys in 2 weeks, having only signed on in July. So we really followed Planet Youth's detailed 10-step process. And our first step was to identify key partners in our community who are interested in youth well-being. Again, that partner pulse check survey took a lot of the guessing work out of it. So the task became assemble a coordinating team. This would be comprised of individuals who are passionate about youth development and have decision-making ability within their organizations. So this team is ultimately the one that's responsible for driving the initiative forward, providing advice on project structure and direction, building capacity for the citywide implementation of the Planet Youth approach, and all this while maintaining a local ownership and grassroots orientation. And then obviously just generally raising awareness related to community substance use prevention goals and this model as an intervention framework. An important piece would certainly be to secure funding and resources to support the implementation of the Planet Youth approach. So for us, that really was a lot of applying for grants, leveraging in-kind contributions from partners, and really just trying to find some sustainability, some strategies to make sure that this approach would be sustainable for us in Timmins. Building a strong coalition is key. We've asked our coordinating team to nominate designates in their organizations to be a part of our coalition. It's really important to facilitate that collaboration with a multitude of partners so that we can pool our resources, whether that's financial, human, or in kind. in order to support these prevention efforts more efficiently and more effectively. Having a wide range of community partnerships in our process ensures that the prevention efforts are inclusive and they reflect the needs and preferences of our own community, which also increases the chances of success and community buy-in. Another really crucial component is a communication plan. It's been important that our process effectively conveys Planet Youth's purpose. It effectively engages our partners. We maintain consistency. We adapt to challenges, and ultimately we achieve our goals. So the communication plan is a strategic tool that we believe is going to enhance the impact and the success of our efforts. So funding and outreach planning are obviously very interrelated concepts of this process, and you need to carefully consider how you will allocate resources that can have a significant impact on your project's success. So based on the cost of substance use in Canada being $1,258 for every Canadian, that means every $1 invested in prevention could save up to $22.69 in societal costs related to substance use harms if these harms were to be eliminated. So beyond sourcing that initial funding to get going with Planet Youth, it's really important to develop a sustainability plan that outlines how the IPM and its outreach efforts are going to be maintained over the long term. So we're always exploring opportunities for ongoing funding and community partnerships that can support sustainability. And of course, there is opportunity to implement low to no cost interventions that are delivered using existing resources. There's also some more costly interventions, but I think the main goal is really to figure out what's working, amplify that, fill any gaps, and maybe stop doing things that aren't working. But truly, it is important to prioritize that funding and that outreach planning for ensuring that your prevention efforts are well-resourced and effectively implemented to achieve meaningful and lasting impact. Please hold. Great. Now, again, you're going to hear this a lot, but substance use prevention is a long-term investment. Although some prevention efforts can have some positive effects in the short term, the most impactful results are going to occur over time, which makes progress towards the goal of a healthier future for our young people and society in the long term. So I've learned a lot from the Planet Youth Partner in Franklin County, and in my discussions with our coalition, I can see our community jumping on a lot of these initiatives that they took on. A lot of these same interventions that don't necessarily include any policy level change, but still create positive changes in the short term. So in Franklin County, they implemented an intervention that involves a leisure time voucher card, which they found that to be a feasible approach to increase participation in out-of-school activities and sports among middle school-aged adolescents. And so students who were offered the leisure card had a 3 times bigger increase in art and sports weekly participation than the control group. And in Franklin County, 9th and 10th graders who do organized out-of-school time activities are more than 2 times less likely to vape daily. They're more than 3 times less likely to have been drunk daily in the past 30 days, and 2 times less likely to use cannabis. In Franklin County, they also implemented parent cafes, which you heard Robin talk about. So these cafes' goals were really to facilitate transformation and healing within families. It was important to build community. They were developing peer-to-peer relationships, engaging parents as partners, and promoting protective factors, because parents benefit from having support from other parents. And parental collaboration is a really powerful protective factor for children. So these are interventions, again, that have already been brought up in our coalition meetings, but it's important to note that even though outcomes are often measured at that teen level, interventions can be broad with an aim to shift the social environment for young children all the way through to the teen years. So that importance of collecting that local data is going to inform the design of your interventions within each municipality. And then based on those findings, you have community-driven goal setting and strategic planning, and then your teams are formed to implement those plans. So the short-term impacts I just discussed are closely tied to population health by addressing immediate health and well-being outcomes within the community. So these short-term gains, such as reduced substance use rates, improved mental health, increased community engagement, they set the stage for longer-term population health improvements and the achievement of broader public health goals. and objectives. So population health is concerned with the health outcomes of entire populations rather than just individual health. It aims to improve the overall well-being and quality of life for a community or society as a whole. So the IPM and the Planet Youth approach aligns with this goal by addressing not only substance use, but also the various factors that contribute to the well-being of young people. So again, the IPM is an example of how public health strategies can be designed to improve the health and well-being of entire populations, which is a fundamental objective of population health efforts. So by addressing substance use among youth and promoting healthier environments, models like the IPM and the Planet Youth approach contribute to the broader goal of population health improvement. So thank you so much. I hope this was a good example of how a community very similar to yours can move this work forward through collaboration, engagement, and paid protected time. So I guess we'll wait for questions for the panel. Thank you.
Thank you very much, Caden. Well, you have heard a lot of amazing information with lots of potential and meaning for us in our community. So just take a moment while I'm speaking and just let your brain absorb that and think, do I have any questions or what am I excited about here? Because now we're going to give you a chance to do what all good educators do. We're going to give you an opportunity to discuss your learnings and enhance them by listening to the others around you in your group. So on your table, there is a worksheet with several questions that says table topics on it. Looks like so. Or perhaps soon to be coming your way. Yes, it's perhaps folded in two in somebody's folder. There should be one at your table. Okay, we're going to have facilitators come around and assist you. What we would like you to do in the next 15 minutes is in your small group, jot down ideas. Can you please listen for all of the instructions? Sorry? Yes, thank you. Write them down, discuss them, then prioritize. And what we'll do is we'll gather up some of the sheets, and then I will ask our panel, which will be assembled by that time, of our speakers, your urgent questions. You can also, as per the instructions on the green card, in the card holder on your table, you can email the questions in, and we'll see how that works. So, text. I've got an old technology brain. So discuss, share, record, and we'll see you again in 15. Yeah.
Yeah. Try to fight it, but you can't even feel it. Try to deny it, but it's coming from someone you love. Not the wisest to deceive. Cannot hide away, but we are in the silence. It's conceited, cause it believes that we're defeated. To our surprise, I believe that what's inside us will release us now. Oh, no, the world just have to trust now. Then maybe we'll find out, but now we're coming to the place in the tall grass where we see that the elders have lost time and the lessons we learned for a long time have all but abandoned our small minds. Dream about nothing but fear, trying to run up a decline. Maybe one day we'll learn the truth, Lord. Maybe we're blind by design.
Thank you very much, everyone. Thank you for your earnest discussions. I eavesdropped a little bit as I went around. So we're going to give you an opportunity now to ask some of your burning questions about any aspects of the programs as you've heard them this evening. And we have our fine group of presenters and others here. So we have Caden and Robin, and then we have Ali, who is in grade 9 at St. Joe's. Ali Khalif is 14. He enjoys sports and fun ways to get involved in the school and the community. He lived in Lebanon for the first 6 years of his life and then moved to St. Thomas with his family. He's a volunteer with CAN, and he would like to make a difference in the lives of youth in our community. So welcome, Ali. And then next is Jenny. And then on the end is Dr. Kelly Scott, who's a family physician who's been in St. Thomas since 2006. And she's been practicing primary care, including working with mental and health addictions issues. So we will allow you now, rather than collecting the papers, you have them there. Jessica's going to take the microphone just now, and she's going to come around to you so you can decide on a spokesperson who will ask your first pressing question, and then she'll go on to the next table. So thank you in advance for your participation.
David James, I was told to come see you.
Thank you. Thanks, yes. Yeah, we had a couple of pressing questions. One of the issues, I live in West Elgin, right at the far west end of Elgin County. I'm on the board of the Community Health Center, as is Larry. One of the issues for us, and I note that Timmins has a population that's similar to St. Thomas, about 42,000. But how workable is this model when you get into rural areas with small populations? Because the youth in West Elgin and Dutton Dunwich are forever complaining, oh, there's all kinds of great programs in St. Thomas, but we can't get to them. Our parents can't drive us to them. It's too expensive there's no bus, there's no way of getting to them. How viable is this program in small rural communities?
So I would say for us at the Porcupine Health Unit region, we have a lot of smaller communities. So in Timmins, we're going to be starting in Timmins. We're going to be carefully assessing the effectiveness and the efficiency of implementing this model in our most urban setting, and then we hope to expand into our smaller communities later. You talk about the lack of access to transportation. I anticipate that being an issue for us as well. So we've customized our survey to be a little more tailored to these sorts of questions. Is it the lack of access to transportation? Is it the lack of access to opportunities? Or is it the fact that there's no space for these opportunities? So once we get that data back, then we'll bring that back to the community and say, hey, how can we increase the access to the transportation? How can we make it easier for our young people to get around? How can we make it more appealing for them to get around? Because maybe the city transportation isn't necessarily appealing to them. So what can we do? How can we work together to make that better for them? I think that there's actually a lot of power in smaller communities and smaller rural areas because we're looking to our community members to say, hey, you know your community best. These parents, these educators, these community leaders, they know their community best. So how can we work together to increase access, increase these opportunities? And it's not just about making the opportunities available, but how can we make sure they're high quality? So how can we embed things like social emotional learning into these opportunities, diversity, equity, inclusion? How can we embed these into those opportunities as well? So it's really going to be bringing it back to our community members. I don't necessarily see that being I actually think that it's better being a smaller community because we have these existing relationships with a lot of our community partners already. I hope that answers your question.
I'd like to just add to that, just knowing all the sites we have around the world. One great thing about Planet Youth is you define your local unit. In Vermont, this did look a little different because we do have rural communities too. So one of our sites has 3 rural communities that considered themselves one community. So you do get to define your local unit as long as it makes sense with data collection and implementation of activities.
Thanks. I have another one.
So first of all, one of the things we noted was the tremendous hope that's inside this. It is a long-term process, but just seeing anything, something that might offer that chance of hope was tremendous. So to start with that. What I'm personally curious about is if there's any data that has a correlation with not just the descent in use of substances, but whether the society inside Iceland has any metrics of happiness or mental health improvements, all those things that come alongside it. Do you have things that actually relate to that show as it goes down, something else goes up or not?
That's a great question. And I will say I probably have to go back to the team that does a lot of our research and then get back to you on that. I don't want to make just a general statement on that, so I'll have to find out. But we do have other measures that we do research on, mental health being one of them. We just released a publication maybe about a year ago, and just looking at the Icelandic prevention model and how it relates to other factors outside of substance use. So I know it doesn't answer your question fully, but let me get back to you on that and talk to our researchers.
I would maybe add too that I think the process, like you said, truly is the progress, right? Getting those people in the room, people who care, and making that the norm, right? So I think that that's what we see a lot with this model is really empowering these groups who have a vested interest in youth development. And beyond that, with the slide that Robin was showing as well, when we saw the decrease in substance use, decrease in alcohol consumption, at the same time we saw participation in sports going up and time spent with parents going up as well. So I think that those are two kind of things that you see. As you see one go down, a few other things do go up, but potentially not those measures at the society level until Robin gets back to you with that. But yeah.
I would just also go back to the idea that we're looking at the community as the patient. So not that individual level, right? But it's in some examples, it's the parents who are getting support and maybe the parents' mental health that's improving. It's the maybe the decrease in maybe more destructive activities that are happening in the community as a result. And there's also data about our adult substance use problem, and so these youth go on to become adults. And so it's not necessarily just those measurements of the individual children that you're surveying, as you're pointing out. So I think there is data about that. We don't have specific numbers for you right now. But thanks for highlighting that point.
Anybody else up there want to share anything or no? Okay. I've got questions over here, David.
I got two questions. They're kind of related. Can I ask both?
Yeah.
So the parental involvement seems to really focus on healthy parents. So what about the parents that are already struggling quite a bit, whether it be substances, mental health, financial stress, and burnout?
Such a great question.
Yeah.
So we don't just focus on healthy parents. We're focusing on all parents in the community. Some of the actions that communities take on, whether it's parent cafes, the parent contract, often you are going to get those active, engaged parents in the room, but we do find the more parents you reach across the community, it's going to have an impact on all youth in the community. So if you get 60% of the parents in the room, it's still impacting those kids that where their parents aren't maybe engaged in these activities. They're still going to get those positive effects. But we are looking to reach all parents, and sometimes you have to create initiatives that work well for your community. So if you're hearing us say, some communities implement a parent cafe or a parent contract, and you know that that's not going to work in your community, this is the great thing about the model is that you can adapt it to what's going to work well. You know your community best. But the general idea is that if you do engage the parents that want to be engaged, you are going to have an impact across all youth in the community if you keep reaching out and you keep trying to implement these efforts. Does that answer your question okay?
Yeah, I think so. And then the other one that's sort of related to that is we talked about a lot of the emerging evidence coming out about attachment issues at a young age. So why do we wait until grade 7 for some of the data and the targeted interventions?
That's another really great question. So we do survey 15, 16-year-olds, or some communities do a grade range of 7 to 12. That happens a lot in the United States. While we are surveying that age group, we're not saying that interventions are targeted just at that age group. We always say that you want to target all children in the community, all ages. One of my coworkers says you even should be talking to pregnant women before they even have their children. So your interventions aren't just for that age group you're serving. That's just for us to see what's happening right now. It helps us monitor over time. But you really are targeting your interventions across all age groups.
I would just add about the healthy parent question as well. So as a family physician, I have entire families as part of my practice, and there are maybe kids that aren't necessarily coming to the doctor, but that I worry about that kid or that family, and I know some of my colleagues are in the room as well who see that. And that's exactly why we need a community approach, right? So that particular family might not be capable of providing the support that child needs, or enough of that support. And so that's what the model asks us to do, is to treat that as a community, not not to expect a single family or a single parent to just parent differently, and that would solve the problem in the whole community. So I think again, it's the healthy parents who maybe volunteer or come out to things that can then help support the other parents and can be role models for maybe the kids that don't have healthy parents that are participating in activities.
Yeah. I would also add, if you're interested and curious, to check out Parent Power, which was an initiative by Planet Youth Ireland, and it's a web page, and it is wonderful. It has so much really great information for parents. I could see Timmins doing something like this in the near future as well. It's kind of like a one-stop shop to find information about attachment, etc. And then kind of tying it into your second question, I got that a lot as well when I was bringing this model to the community. Like, why are we surveying these grade 10 students? What about the other students? And what Robin said is so true. Like, it doesn't really matter at the end of the day who we're surveying, because we're using it as an indicator to let us know that whether or not these initiatives and these interventions that we're implementing, are they working, are they not, what should we do next? So as you know, we do see that substance use and risky behavior tends to start at that grade 10 level. It's really not we're not sampling, it's population based. So our interventions are broad and aiming to shift that whole social environment, not just the group that we're surveying.
One of the questions that came up at our table was thinking of Allie, who's been a great asset to the planning committee. How involved are youth themselves on the coordinating committee? Are they part of it? How does that work?
Well, I mean, there may be a lot of opportunities for teenagers and mostly children under the age of like 13, 14 to involve themselves in being able to prevent substance use and abuse, but it depends how accessible it is to the person. So people, let's say, that aren't as informed as, let's say, someone else may be scared or worried to go share their thoughts and ideas. And most of these opportunities to share their thoughts are for younger children, and they're not as targeted to kids my age personally. So like between 13 and up. Hope that answers it.
Caden, are you doing anything with youth in your community?
So that's where we're at right now. We're really aiming to increase our youth engagement in a way that's meaningful and impactful for our community. So we don't want any tokenism. We're trying to tap into existing youth groups. So we in our community have, it's funded by the Registered Nurses Association of Ontario. It's called the Youth Mental Health and Addictions Champions. So we rebranded it as the Youth Wellness Initiatives for our schools. And so we'll be looking to our existing groups, our existing partnerships with these schools to kind of, once we get our data, we're going to bring that back to the youth and say, hey, what would you do if you're seeing that your peers aren't getting enough sleep, your peers are engaging in risky behaviors? What course of action would you take? So that's our plan once we get our data back and our school level reports. And I'm also tapping into our Youth Wellness Hub. So they have a youth advisory committee that already exists. I think it's a challenge to organize groups when there's already so many groups out there, a lot of the same people already sitting at the same tables. So we're going to be trying to capitalize on that and being able to tap into those existing networks and see how we can include them in this process. But at the same time, Planet Youth is always saying, right, youth should be involved, but they're not the responsible ones. So we're going to bring our ideas back to them, but we're not leaving it up to them to say, hey, what should we do? It's more like, how would you feel about this? Or, what would your strategy be? And then kind of go from there.
Thanks. Hi. As a play advocate, I become concerned when I hear about more structured activities for children. There's a lot of evidence to say that our kids are more structured than ever. They have less time available to play, to socialize, more pressure on them for, excelling in sports. So, I wonder how much room is there for just play and connection to nature and to other children, but also at our table we are wondering what is being made available to the youth and children.
That's a really great question. So I guess the wording of that could make it seem like we're only pushing very structured, maybe like sporting activities, but that's not really the case. What we're looking for there is time for children to have quality time with each other and have a quality adult that's there. So we're really looking at that versus unsupervised time where maybe they're hanging out in a mall or hanging out late where there's no adults around. So a lot of our sites do open teen centers or places where there's more unstructured activities, but still supervised and sort of in a way bringing them together to have that unstructured time. So there is that opportunity.
Yeah, I would also say that to your point, right, it's not just participating in these sports that has the protective factor. It's not the facility that has the protective factor. It's the adult and the professional in charge. And so making sure that we are offering opportunities for training so that we are, again, embedding things like social emotional learning, diversity, equity, inclusion in our programming so that children feel safe, judgment-free zones, but still have that opportunity to make a connection, have a secure attachment with an adult who cares about them.
Great. Did you want to share something?
All right, good evening, everyone. I guess I'm going to kind of piggyback on the structuring aspect of it, because as we sat here and we discussed a lot of these things and listening to the model that's in place, we have parents who may want to have their children involved in things, but are not necessarily there. You have single parent homes, you have two parent homes. Both parents may be working, or the single parent may be the one that's pulling the ball for everybody. How does your program set up to deal with those issues with regards to the children who really need to get involved but are not able to get there because a parent is not available, nor is there transportation available because, one, they're in a small city and that transportation is not readily available for them either?
That's a really great question. So this is about tackling the issues that you're experiencing in your community. So if I'm hearing that there's no transportation or no way for a young person to get involved in activities, I'm thinking, how do we tackle that? We have to look at the root issue there. That's something that action planning would have to consider, instead of just saying, let's add more leisure time or out of school time activities. If young people can't get there, that's the question you're going to be asking in your action planning. How do we make it so young people can get to these activities? How can we make sure there's transportation? And we had to look at this in Vermont too. We have very rural communities. There's not a lot of transportation options. So that's something that the coalition had to tackle. So we had to go a step further back. It wasn't just about creating new initiatives. It was, let's look at the root cause here.
All right, so we had a lot of questions about funding, but maybe I'll wrap it up into one. So we're curious about other communities and how they have funded it. Were service clubs involved, government contributions, that kind of thing? So could you speak a little bit more about funding and sustainability of funding? And then also we were just wondering about the survey and how often you repeat it, and kind of the long-term cost of repeating it over years.
Yeah, thank you for the question. So the survey is completed every 2 years. If you sign a 5-year contract for the guidance program, you would be implementing the survey in year 1, 3, and 5. And then regarding funding, it's so different across all our sites. So in North America, especially the United States, it's quite common that it's grant funding. It's not always the best option because grants aren't often long-term, and we're really seeking long-term funding. You can sometimes find a 5-year grant, but it's fairly rare. In Canada, and you may be able to speak to this a little bit too, it does vary, but there's a lot of government funding. And then in Calgary, the United Way is funding it. In other sites, I believe it's more government related, especially in Europe. And then we do have sites that, for example, in the United States, they may have the grant funding to sign the contract with Planet Youth, and then community organizations front some money for community initiatives. So they combine that a little bit. I don't know if that answers it well. It's so different across all sites, and it will probably be different for this community too, just because funding options available around the world are so different.
Okay, a follow-up question. Yeah. Could you speak to the cost of the guidance program?
Yes, right now, I'm trying to remember off the top of my head, I think it's 31,000 or 32,000 euros a year. I have to go look at the contract and confirm. And that really provides you with the survey, the data analysis, the reporting, project management, the advising, the trainings, all of that.
In comparison, is there any information about data collection, surveys, and the costs of and timeframes of that anybody can share? Anybody knows? I'm Jenny. Sorry, I'm asking. Do you know anything about, like, from a data collection stance, like what that looks like when it comes to cost and time?
Well, just for the data source that we used for the presentation that I presented today, that in itself because we're a smaller region, we had to pay extra for an oversample to be able to report on anything, and I know that was really high up there as well. Like,
Yeah.
really expensive, like $20,000+, and that's just to get your information. So if I'm hearing what she's saying, like, and that covers a lot of all those housekeeping pieces, and they package it all for you. Like, it's a lot. You get a lot more for your money for what I'm hearing based on what we get regularly and what we can work with. And it's like one person has to dedicate all their time to cleaning that up, to creating these reports, to analyzing, and to be able to make even school-based or school-specific reports. Like, it's an immense amount of work.
In 8 weeks.
In 6 to 8 weeks,
In 6 to 8
which I
weeks.
know was a little bit, any epidemiologist in the room would be like, what, really? So great turnaround time. Thanks for putting that into context. I have a couple more questions on this side of the room, and then we'll transition.
Good evening. So we had actually really quite wonderful and lively discussion, and just knowing that this model has been implemented in different parts across the world, what have been sort of some of the common themes in terms of challenges?
Wow, that's such a great question. Well, my answer, and you're probably going to guess this because I talk so much about coalition building, it's getting that strong local coalition and team that has paid protected time to do the work. I noticed that being a common challenge. You can sometimes pull together those community partners, but people are doing that in addition to a full-time job. So having really clear paid protected time to implement and making it a priority, that is a common challenge across a lot of our sites. I would say it's probably the biggest challenge I see.
Thank you.
I wonder if you guys might be able to share some examples of like policy level changes, because I think those are some, like, we've talked about some of like local initiatives, but I think there's been some other successful examples of policy change, which again, I think would be one of the more challenging pieces to accomplish.
Yeah, so I mean, one of the most popular examples I can throw out there is in Iceland. They have a policy about outside hours for young people, and I believe I'm going to have to confirm with my Icelandic colleagues, but I believe it's 10 p.m. During the school year and midnight during the summer, where young people need to be back inside, and they actually have parents that go out in groups and just walk around and make sure that young people are getting back inside and that they're safe. And if they find anyone that's, using substances or maybe they've had alcohol, they make sure they're safe and supported and get back home. What's really interesting about that policy that was passed, it not only helps support youth getting home at a good time, it helped parents collaborate by going on these parent walks together. So suddenly you have a group of parents talking to each other about parenting and their children and norms in the community. So that's one policy I'd like to throw out there. And then we have a lot of people that do alcohol, tobacco policies. That's common across sites too.
So I'm just going to pause a moment, and if there's any other questions that you want me to come and ask, one last burning question. Otherwise, the information sheets that you filled out at your tables, we will collect those, and I will send out with the recording of this to all the participants with the responses that we can get, so that everybody's questions on their pages are answered. And for those that are virtual and have texted in or texted your questions into us, those will also be added to that. So you haven't gone unheard. We will hear your questions. We will respond to those and send those back out when we send the recording out after the event.
Thank you very much to our panel for handling the questions, and thanks to those of you asking the questions. Well, yes, substance abuse amongst our youth and the horrible cost seems to be a Gordian knot that's impenetrable. What do we do about it? It's a societal problem, and it's bigger than any individual or any small group. So I think personally that the idea of having a systematic approach where we work together makes an awful lot of sense. And once upon a time in a movie, it's something about build it and they will come or something like that. There is money out there. People will open up their purse strings that there's something that's comprehensible and that people are very emotional and powerful in communicating that. So lots of food for thought here, and I'm going to turn things over to Miles. And thank you to all for being here and your participation.
Thank you, Larry. Okay, so with that, really, that concludes our night. We'd like to send a special thank to our guest speakers and our panel participants. Your voice, your time, your insight are appreciated. Thank you for helping to share your education and your vision. We'd like to offer sincere thanks to Larry, our gracious MC tonight. Larry, your leadership helped guide us through. Thank you very much. We also want to thank each and every one of you here in the room tonight. Our room of leaders and change makers, thank you for your attendance and your participation. We hope this has been informative and engaging. I really could feel the energy and the excitement tonight. We do appreciate all the questions we're asked as we think through the utility and scope of this model. Now, the scope of implementing this model, as we've all heard, it is laborious. It's going to take passion, commitment, and a cooperative community effort. So if you would like to continue exploring this journey for us, we are looking for passionate individuals and agencies that want to take this action and look at what it'll take to bring this model to Elgin. So on everyone's table, there is a sign-up sheet. We are asking people if you could please, if you want to be part of this, we're going to set up some follow-up meetings just to talk as a community about our next steps. So please leave your information on those sheets. Did you say so we were going to do a pre and post questionnaire that's at your table. We forgot to mention that at the beginning. So if you have time, if you could just do the post questionnaire, we would appreciate that. So really, this is just the beginning. And I did hear a quote a while back that has really stuck with me through learning more about this Icelandic model and this process. And that is, the best way to predict the future is to create it. If you want to be part of creating the future we want to see for children and youth in Elgin County, the time for action is now. Thank you, everybody. We appreciate your time, and I hope you have safe travels home.
Just tell them to leave their forms on the table, but they can take their book with them.
Please leave the forms, the sign-up forms on the table.
And it's so packed in here. The band sounds great. Double penniless with Greg. How are you? Oh yeah. Thank you. Yeah, man. Did you went to the screening of Pull My Daisy? Yeah. Did you enjoy it?